This is Just Listen, hosted by George Goodman. Today is May 11th, 2026. Welcome to the podcast and my normal plug for please subscribe and follow. It would be nice to tell someone, hey, George Goodman is okay, and let's listen to this podcast, which is short, brief, and concise. Okay, so let's get into it. Today we're going to talk about the U.S. federal government policy on health insurance. And trust me, I'm not going to bore you because if you look at health insurance, it's the most complicated regulations, laws, agenda that you will ever know about. And honestly, the sound bites on it don't give it justice to what it really covers and who actually gets to do it. So my focal point is I want to look at the cost and I want to look at who's eligible. Okay, so the people who are actually eligible for it, and we're talking about Medicare, Medicaid, CHIP, from the federal and state levels are low-income adults, children, pregnant women, elderly adults, and people with disabilities. Now, the people with disabilities, the children, and the pregnant women are covered without the federal poverty level equation. And I'll get into that in a moment, and you'll see why that's important. So let's look at this. Let's look at the cost. Now, the Department of Home and Human Services runs this program, and the programs that the budget covers are Medicare and Medicaid. So if we look at how much we're spending on it, projected spending in Medicare for 2026 is $1.18 trillion. For Medicaid is 931.7 billion. Now, Health and Human Services is the agency that covers this, and it's the lion's share of where the money goes. Now, why is this important? Well, we're spending trillions and billions, I just told you. For fiscal year 27, the budget proposal is 111.1 billion in discretionary authority. Now, if we look at who's covered, and I want to back up for a second and talk about the federal poverty level. I've mentioned this once or twice. With healthcare insurance, the criteria is based on how much money people are making. They use the term low income, and as I've told you previously, define what low income is. So it's based on a concept from 1963 and 1964 where some staff economists at the Social Security Administration wanted to define who would qualify. So, measure of income used by the U.S. government to determine eligibility for various social programs like Medicaid and SNAP and the Children's Health Insurance Program, CHIP. And this is what they came up with, and you will be alarmed by this. So, if you look at the 2026 federal poverty guidelines, this covers healthcare insurance. So if the household size is 1, you can only make under $15,960. If you live in Alaska, it's $19,950. Hawaii, which is more expensive, is $18,360. Now, let's go to a family of four. We can all agree that on average, this is the American size. All right, household of four, and you can only make under $33,000 to be eligible for the program. If you live in Alaska, it's $41,250. And then if you live in Hawaii, that's $37,950. Now, there's also something called a multiplier. So it's a multiply the base federal poverty level for the requirement to be eligible. So they made it even more complicated. The federal government did with healthcare insurance. And here is what it is. So normally, if you're trying to qualify for health insurance, you have to go to the website or to their homepage, and then you have the 100% federal poverty level, 138% federal poverty level, and 200% federal poverty level. These are to qualify for Medicaid and for SNAP and CHIP. Okay, so we agreed that a family of four is the normal baseline for people to qualify for these programs, and these are for healthcare insurance programs that, and Medicaid is definitely that, and Medicare. Okay, so family of four, $33,000. Then that's for the 48 continuous days. If you make under $33,000, then you qualify. In Alaska, it's 45,540, and in Hawaii, it's $66,000. So you figure that out. So let me hone in on Medicaid for just a second. Now, when you talk about being senior and qualifying for Medicare, Medicaid, last week I talked about those programs. The first thing you have to do is apply the federal poverty level, which means that most people who have had, I would just say, an okay career don't qualify because of the way that those tables are made. And to get to the point, all these regulations and guidelines don't really matter because most people cannot qualify for it in the first place. So elderly adults and low income adults for healthcare insurance, they're not going to qualify for any health coverage from the federal government based on the federal poverty levels that I just told you about. So that's a realistic look at what is going on with healthcare insurance. And you probably haven't heard this type of explaining it coming from anyone but me. I have an elderly mom, and my eyes were opened. She had a good career, so did my dad, and they don't qualify for Medicare and Medicaid programs for health insurance coverage for certain things based on not being meeting the criteria of the federal poverty level. For example, you probably have seen the same thing. I'm 62, so my mom is in her 80s. So that's something for you to think about. And also, how much money we're spending in healthcare when most of the people, I would say 80% who pay into it, never use any of the coverage based on how much money they've made in their career. So I just focus on those two. Now, I would say children and people with disabilities, they don't hopefully fit into that criterion. I hope not. Couldn't really find any information on that. All right, so here are the new changes coming to healthcare in the future. Special enrollment credits in 2026. Individuals in the Affordable Care Act coverage during a special enrollment period based solely on income without qualifying life event may no longer be eligible for premium tax credits. We know about that. The Congress let that expire. Federal and state protections increasingly focus on the use of AI in insurance claim denials, requiring human review and transparency in AI-driven decisions. So this one is actually important. You only hear it from me. AI cannot deny your insurance. You need the humans to explain why they are denying your insurance claim. So this is actually a good one. AI regulation. AI cannot do that. All right. Refugee assistance, effective May 2025. Eligibility period for refugee medical assistance was reduced from 12 months to 4 months. You have to decide how you feel about that. So here we are in 2026. We're paying trillions of dollars in healthcare insurance. And oh, by the way, the United States leads the world in cost for healthcare insurance. And the United States, covers less people than the Europeans who have full coverage for everyone. And if my research, they keep blaming it on the doctors making too much money. It's a free market. We got to quit blaming doctors and really look at who is getting health insurance in the United States. And if we're spending trillions of dollars, we need to cover everyone or give everyone at least some kind of coverage. The federal poverty level rules exclude most of the country based on how much money that somebody can make, and it seems like it's more geared toward if you have 6 or 7 children, you get the most benefits. And I don't think that that's how it should be designed, because working class people in the United States need health care coverage. What do you think? This is Just Listen, hosted by George. Only went 14 minutes. I think that it was exciting. Have a great day.